local news, politics, business, sports, arts, music. Mike and Marty on the feed. Mike and Marty. Mike and Marty.
Good morning, Bellows Falls and Keene. Where did I get that? Anyway, welcome to the feed. It's Mike and Marty. Today we're here with the director of Sojourns, Sara and Dr.Kai Morrison. We're going to be talking a little bit about acupuncture here in a little bit. But
I'm so
first,
excited. Anyway,
local events.
Local events. So at the Bellows Falls Opera House this week is Meg 2, The Trench. So if you saw Meg 1, you know what the Meg is. If you didn't, it's a giant
shark.
Giant shark, okay. Good thing we have pictures, visual aids. Classic movie this week is Blazing Saddles. It is an R-rated movie, and it is sponsored by James Plumbing and Heating. Once again, another one of the regular sponsors of the movie theaters for classic movies. Not this Thursday, but next Thursday, the 21st, is the return of Overflow the Opera House. If you remember last year, they changed the format a little bit of Overflow the Opera House. The idea is to bring in a bag of groceries and put one bag of groceries in each seat at the Opera House. And Our Place is the sponsoring agency. What they did last year and what they're doing again this year is they're saying that you can just buy a seat at the Opera House. So for $20, you can donate $20 and you can buy a seat and you don't have to go out and get to groceries. And what that actually allows them to do is that actually allows them to use the money to get the items that they really need.
Yeah, it's actually better.
Yeah, they tend to get an abundance of peanut butter and macaroni, so and canned soups, which are great. It's awesome, but this allows them to really target. So, and it also means you don't have to clean your cupboards out or go shopping. So that's next Thursday, the 21st, from 8 to 4 at the Opera House. Happening on the 23rd is the third of the Ray Masuko concert series. It's Chris Smither with the Suitcase Junket. The Suitcase Junket, I didn't realize, is local. He is from Grafton. Chris Smither has played in Bellows Falls many, many times, so there's many people that are excited about his coming. And the Opera House is looking pretty full. So there's still seats available, but I might suggest that if you're interested in going, that you get your tickets like within the next week or so, because it looks like this is a pretty well-attended concert. And then happening on Wednesday, the 27th, at the Rockingham Free Public Library is a presentation called Europa Clipper Mission. So Bob, I'm gonna butcher this name, Paparado. I'm not even gonna go there. Bob is gonna be there to talk about the Clipper mission. It's a mission to Jupiter, and again, it's free. And there's an opportunity. I was just trying to remember what Sam was telling me. There's an opportunity to have your name engraved on the ship that's going there. So that's pretty cool. So lots of happening events. I'm going to cut it short because I'm so excited to talk about acupuncture. I don't know anything about it. So welcome. Thank you guys for coming.
Yeah, thanks for inviting us. It's great to be here.
So tell me, for the novice person, what would I need to know about acupuncture? What is it? How does it work? And how do you benefit? What are the benefits?
Yeah. Well, acupuncture is really just one branch of Chinese medicine. And I think an important place to start is understanding that the people who developed the system of medicine were farmers. They were observing patterns in nature. They were observing how the seasons changed. And that understanding that unfortunately we really have lost in Western medicine of how our bodies are not disconnected from that, right? So the same patterns that influence the world around us influence our own health and well-being. So from that perspective, acupuncture works to stimulate and promote what we call qi. Qi can be translated as lots of different things, but I understand it as vital force or life energy. So there are maps of the meridians or the acupuncture channels that run all throughout the body. And we can think of those like waterways in a way. So if there's a blockage in the river, you're going to get, some flooding or some bogginess upstream.
That's a really good analogy. I like that.
Yeah, and downstream maybe there's a drought, right? We can all kind of relate to those, how powerful water can be and how it can change the landscape. So with Chinese medicine, we use a lot of metaphors. We use a lot of looking at patterns. And it's a beautiful system of medicine. It's a holistic system of medicine that understands that nothing is disconnected. So when somebody comes to seek acupuncture treatment from me, maybe they come for back pain, but I'm gonna ask them about sleep. I'm gonna ask them about their diet, about their emotions, about stress in their life. And all of that helps me understand how I'm going to best support their body in resolving that back pain. So, 5 people could come in with back pain and I'll do some of the same needles, but not, the underlying treatment might be different for all of them. So it's a wonderful medicine. I love to practice, yeah.
Interesting, because it brings out the idea that, a lot of times we have a symptom of something and we think it's one thing, but it's really not. It's just a symptom, but it's got a deeper root cause. So does this get more to the root causes?
Yeah, absolutely. And helps us understand the symptoms of our body as really the way that the language our body uses to communicate with us when something is out of balance. So Chinese medicine in general and acupuncture specifically seeks to find where are things out of balance. Is there too much or too little? Is it hot or cold? Is it damp or dry? And kind of bring that back into balance. And that's a basic principle of homeostasis, right? Our body kind of yearns for that place of balance. And those symptoms are a way of our body communicating to us how we can course correct.
I think in a previous, and maybe Sara, you can correct me on this, I think when you and Cliff were here, we talked about ease, your body being in a state of ease versus a state of dis-ease.
Yeah.
So the same type of idea, the stasis and this ease, so it helps your body be in a better state and not in a state of disease.
Well, and I think that's why we offer it at Sojourns, because it's such a nice complement to naturopathic medicine, chiropractic, the physical therapy. So a lot of times our providers will cross-refer internally, and so Kai may see a patient who's seeing someone else for chronic Lyme, or, can you speak a little bit to that, how it supplements and complements other modalities?
Absolutely.
Yeah.
The acupuncture, it's going to stimulate the healing process, but we always want to be doing internal medicine as well. So that's looking at diet, looking at lifestyle, potentially using herbal medicine. Because it's all connected. So I'll have, I have a number of folks who come to acupuncture who are, seeing a chiropractor, seeing a naturopathic provider or a conventional doctor. And you asked sort of why would somebody go for acupuncture? Most often people are coming for pain, for musculoskeletal pain. And it can be very effective for pain. And especially when maybe they've tried a lot of pharmaceutical options and are finding that it's just not enough. It can provide another layer of relief for folks. And it's also, when they start coming for the physical pain, then often there's more that gets addressed.
It's like an onion, you peel the layers.
Yeah, I have a very dear client who comes regularly for some pretty chronic left arm pain that affects his activities of daily living and the things that he loves doing in his life. And, maybe after like 5 or 6 sessions, I was like, so it seems like you're coming back in every week and your arm pain's still there. He's like, yeah, I don't know that my arm pain's getting better, but I just feel so much less stressed, and my mood is better, and it just creates again this sense of ease in these other areas of his life. So that's, I love working on the emotional plane and on the nervous system. Acupuncture can help a lot with stress, trauma, behavioral health, all of that.
Interesting.
Mm-hmm. So you're seeking balance, but what diagnostically, what sort of techniques do you use?
Yeah. It's a lot of observation. Mm-hmm. So we do deep listening. So I'll do an interview with a client and, getting their history, and I'm really listening for patterns there. And then a palpation, so I will feel the pulse, and I'm feeling qualities of the pulse. I'm not counting the rate. It's not about the heart rate. It's more about how it feels. Does it feel really full and pounding, or is it sort of thin and weak? And then also I look at the tongue. So the tongue is the only muscle in the body that we can directly visualize. Oh, wow. And there's a whole map on the tongue of the different organs, and so that gives me information as well. And I may palpate points on the body. So I'm often telling people, let me see your tongue.
So don't suck on an orange or yellow or red candy before you go in.
Yes, people will be apologetic about that. No, I just had my coffee. That's okay, I can tell. Yeah.
So we do have planned that I am going to do some needles today. So can you talk a little bit about that?
Yeah.
We'll place the needles, and then I can sit and enjoy the needles. And so I'm going to be the guinea pig today, because I've actually never done this, so this is fascinating. And then I think you have some announcements, so I want to make sure we don't lose that. So let's go this first.
Well, I wonder do we have a moment for me to talk about community acupuncture?
Oh yes,
first?
Most definitely.
Great. So traditionally in China, most acupuncture is done in a group setting, and in the U.S., it's often you kind of have the image of you're alone in a room on a massage table, which is a lovely way to get acupuncture as well. But at Sojourns last year, we did start a community acupuncture shift. And the benefits of receiving acupuncture in a group setting are multiple. One is that it allows us to offer acupuncture at a lower cost because we're seeing more patients at a time. So it reduces that barrier of access that unfortunately a lot of insurance companies do not cover acupuncture still. So people are paying out of pocket. So that's one awesome thing about group acupuncture. And also there is this very special thing, this additive property of receiving treatment in a group where there's just a different kind of healing space that's created. And I think also some of the research shows that you no longer feel so alone in your pain because you're coming into a space and everyone's here for different reasons, but we're all here getting support for something that we're struggling with. So unfortunately we don't have enough space at Sojourns to be offering it more regularly, but there are other community acupuncture offerings. I think there's one in Springfield and down in Brattleboro. So.
And how does it, do you sign up, or how does it work?
Yeah, at Sojourns it's also still by appointment, just so we can kind of manage my flow of people.
Typically, how many people are in the group when you're doing that?
I have 5 chairs. So, and it's kind of like a rotation. So, staggered. It's staggered. Yeah. Okay. In other settings, there might be a lot more people. So in terms of some of the logistics, the acupuncture needles are very different than what you might think about, like when you got a blood draw or a vaccine. They are solid, and you probably won't even be able to see it on the screen, but it's flexible. It's very, very thin and very...
It looks like almost like a little bit stronger hair is what it looks like to me, just in the light. Like when you see when they do the hair test and you pull your hair till it looks like a drawn out hair, just a little bit thicker.
Yep. So they're very, very thin, and because of that, they really don't hurt. You sometimes, what I'll talk through, so I have a new client here who's never had acupuncture before, and we've done the whole...
she might be hamming it up a little bit.
Usually what I tell people is sometimes you might feel a little prick or a sting at the initial insertion, but after that it really should be comfortable. And if any time the needle feels sharp, let me know and I'll just back it out or remove it even, because there's so many points. We never have to do that one point, right? If something doesn't feel good. The goal of the treatment is for it to be deeply relaxing. And some of how acupuncture works is it puts you into more of a parasympathetic state. So that's the kind of rest and digest place in our nervous system that allows your own healing vitality to flow, right? So I never want someone to be tensing up and sort of grinning and bear it, as they say.
No, I think I'm good on that.
Okay.
We'll see.
And yeah, so what else do I typically tell people? Sometimes you can feel kind of like a dull aching sensation or a pressure sensation. Sometimes you don't even feel anything at all, and that is all normal.
Okay.
Okay. So do you want to put your hand down?
Sure, I can move this over to the other
Okay.
side. Okay.
Great. And now I didn't actually ask you anything about what's going on in your body, because we're doing this more as a demonstration and not as an actual treatment for you. So I wonder, if you just kind of relax your hand like that. I'm going to feel your pulse, make sure that all that feels really good. I've never done acupuncture in front of a camera before.
Well, then
We've
both
never
on
had
a
anyone do
journey. We've never
acupuncture.
had anyone do acupuncture in front of.
So this point that I'm doing here, I will share, is a really great point for headaches. So if you,
Good catch.
you also can massage it yourself at home, and that's acupressure,
Okay.
right? There you go.
I bet your
Did you
headache's
do
gone.
it?
My headache is gone. Yeah. No, it's funny because you said headaches, and it's funny that you said that, and that's where you chose. Because I don't know if it's the weather or if it's just job. I'm getting a few more headaches than normal lately, so this is a good thing. One of the things you mentioned before we started talking was you said that there's actually a pamphlet out that said, "Why did you put that needle there?" So you want to talk a little bit about that, like how it might be in your foot.
Yes.
The pain is in your back.
So I have a great example of a client who had really, really awful occipital headaches. So pretty severe, waking her up at night, kind of the back of the head would wrap around to her eye. Now that happens to be the exact path of the bladder meridian. And I won't go into details about what that means to me diagnostically, but the bladder meridian runs all the way down both sides, both sides of our spine, all the way down to our pinky toe. So I was doing points around her ankle and her foot. And after one session, she came back and said that she hadn't had a single headache since I last saw her. And now that was awesome, right? And doesn't always happen that way, but just speaks to how profound acupuncture can be. And of course, I did some local needles for her as well, right at the areas of pain. But the further away you are on the channel, you actually have more leverage. It's kind of like if you think about like a fulcrum or something. Yeah, exactly. So we often do points around the feet and the hands. Those are the ending and beginning points of the channels. Do you want to try a little bit in your ear? So there is a very
Same side.
yeah, just for ease of.
So you talk about channels, and like, are the channels on a map or a chart that you can watch? And did you learn those in school?
Oh yeah, I spent many years studying them. Yeah. And a lot of palpation. So we learn how to kind of feel for where the points are. But it's anatomy too. So it's understanding, this point is, right there. And we have a system of measurement too that we use our hands to measure. So ear acupuncture is a whole separate system of acupuncture. And there's an organization called the National Acupuncture Detoxification Association, NADA. And there's a protocol of ear acupuncture that has been really well studied and is used very frequently to support people going through extreme trauma or PTSD, supporting with stress response and detoxification if they're going through any kind of withdrawal. So it's available in the community around here. I know there is an acupuncturist who works at Turning Point, I believe in Brattleboro, offering NADA protocol. And I do it on most people because we all have stress and we all have things that we're detoxifying from in the environment. I guess the camera won't be able to necessarily pick that up, but the ear ones can be a little more pokey sometimes.
I definitely feel it. And when it went in, but then it's like, meh, nothing. That's interesting about, like, I'm always fascinated with how all of these things are available. They're technically non-invasive, they're not addictive, they're not whatever, but why aren't more people doing that?
Good question.
I think I think insurance coverage is a big factor.
That's true.
Yeah.
And I think we've had this discussion, like, why don't insurance companies like realize that this is valid treatment?
Yeah, and some do, but yeah.
Interesting. Did you want to give your, we're down to about a little under 5 minutes. I want to make sure we have time to talk about
sure.
some things
Thank you,
coming up.
Kai. Thank you, Marty, for being our demo
Timekeeper. Oh, yes.
2 quick announcements. This Saturday, we're doing a Clean Up the Shed day at Sojourns. And I think they'll put the address on the last slide here, but we're 4923 US Route 5, 9 a.m. Bring your work gloves. We're just going to clean out our local sheds so that we can start to clear that space for future potential renovations and community space. And then later this year, November 27th through December 3rd, we're going to be featured on a Gut Health Reset Summit. And so I'll be speaking along with over 30 other practitioners on gut health. And so if you guys are on our email list, you'll be getting emails about how to register for this free event. And by registering and signing up, you'll position Sojourns. If we are in the top 3 to get a certain number of opt-ins to the event, we get to put our offer in front of the whole list for the event, which is great visibility for the clinic and our on-site store. So as many of you know, we're a nonprofit, and the store is a great source of revenue for us. And so while we're helping people with gut health, we also would love to have community engagement and buzz around this event so that we can boost visibility for our store and bring in more streams of revenue.
That's great. Gut health is, it seems to be the like the root the root of a lot of evil.
We are what we eat on
Yes.
some level.
Yes.
Well, and Kai has a lot of wonderful experience in food as medicine too. We're hoping to do more education around that, and videos and classes and things as well.
I'm kind of in the baby stages of learning all of the things about gut health, and it's fascinating the amount of things that can go away if you have good gut microbiome.
What's your biggest takeaway on a food that you've either started eating or taken away and seen the impact?
I would say the energy, like an energy level, has been the biggest thing.
Yeah.
Like not realizing that it wasn't necessarily, I'm saying there's compounding factors, but it wasn't necessarily lack of sleep or too much caffeine or too much sugar. It was like my gut wasn't happy with something that I was eating, and if I don't eat it, my energy is better.
Yeah.
Like that was for me, because that was like probably the biggest thing is like, why is my energy down so much? So.
Well, and the beautiful thing about living in New England, I've come up from the DC area, but up here it's so easy to buy local fresh food, and that makes a huge difference too. Just eating what's grown near you, and listening to what your body needs. It's interesting, I saw a lot more dandelions in my yard this year, and I was listening to a health coach who said that, notice the plants that are popping up around you, because dandelion is a very cleansing, right? Like a detoxifying.
Yeah, it can support the kidneys and the liver.
Yeah, and so I had been drinking a little extra wine around that time. So
I was just gonna ask you if you made it into tea, but you went straight to the wine.
No. I ate the dandelion because my liver needed this.
But you can make dandelion wine, right?
You can. Oh, can you?
Isn't that a song, dandelion?
Yeah,
wine?
there was. I think maybe a
Or
book
a group
too.
or something.
Yeah.
I don't know. Now I totally digress. But, oh, that's funny.
Well, and also eating what is in season is an important thing. So, and that this time of year, as we're transitioning from summer to fall, maybe we were eating a lot of watermelon and cucumbers and maybe a lot of ice cream over the summer, and now is the time to kind of be eating more neutral foods. Yeah, and that, from a Chinese medicine perspective, is going to avoid accumulation of damp. Which will then affect the lungs as we move into the fall. So,
wow. So what are the needles made of? Are there different materials?
Nope,
or?
they're stainless steel or surgical grade steel. Yep. And the handles can be different. Like these are plastic handles that are red that are helpful in community acupuncture, so I can make sure I see all the needles. Or they're steel coil.
Okay.
But yeah.
Were they traditionally, from the Chinese medicine, were they always metal, or were they
probably
bone,
like bone and stone?
Yeah.
And I did bring some of my other acupuncture tools. These I use with kids. So these are non-insertive needles called Taishan. And so, these, it's the same idea. I would
like
just
push the
hold it,
pressure?
at the acupuncture point. Or maybe here. Let me see your.
And we're
out of time.
We are out of time, unfortunately. I knew this would happen.
This always happens. We really get
Super
into
quick.
these things.
If anyone, they just need to call Sojourns and
Yep, the
inquire
number
and make an
will be on.
appointment. So, I guess I'll have to let you all know next week how this
Yes.
goes.
Well,
Thank you so much.
all right.
for
Thank
coming.
you. And that's it for this week. And thank you guys for coming.
See you next time.
Yeah. See you next time.
Local news, politics, business, sports, arts, music. Mike and Mike.